Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 182. I am so excited for today's guest. Dr. Joshua Goldenberg is a naturopathic physician. And of course, if you've been a listener for any length of time, you know that NDs are my absolute favorite guests. Well, today we have with us an amazing healer who's going to teach us how to recover our gut health. And also, he has another gig besides working with wonderful patients. He works with other holistic healthcare professionals and doctors in helping them to become even better at what they do by bringing more science, especially with holistic health. I think we really need to lean heavily on all the latest and newest science. So we can really defend ourselves when people say that an ND is a quack because we're using all this goop and these herbs and mystic potions, when there's lots of science that proves that nutrition and herbs and diet, these lifestyle changes that NDs can help you navigate have so much of a greater impact, and in fact the only impact when it comes to actually healing an illness, rather than using a drug which is going to mask symptoms. And as you may know, NDs also know how to use drugs, but they use them more responsibly, and they look to help you heal the root cause first before having to use a prescription. So they're very responsible doctors to go to. They're my favorite doctors to go to. And I'm so excited to have Dr. Joshua here today to teach us. Welcome to the show.
Thank you so much. That's a heck of an introduction. I love it.
Oh, well, you are at a wonderful time in your life. We were just talking about that. You have a baby on the way. You just moved. You love being a healer, and you also love helping holistic healthcare practitioners become even better at their job, become even better healers and more effective healers. We're going to definitely get into all that, but first, I'd love to hear your story. I'm just very curious about you and what led you to become a naturopathic physician that also is so interested in the science.
Yeah, so that's I love that you start with that. I think that's really fun. Well, it's kind of a interesting story, and I would say unique, except that, one of my favorite memories from naturopathic medical school was just, I mean, one of the best things about the programs is just being surrounded by so many incredible people. And one of the most fun things to do was to hear people's stories, because they all had these amazing, out there, crazy stories about how they found out about this crazy little profession, and found their way over to Bastyr in my case, or one of the other programs. And so I definitely had a crazy story. I was pretty much just a science-minded student, I suppose. I was going to go and do a Ph.D. and become a researcher. My training in undergrad was in molecular biology and genetics at UPenn, and that was what I wanted to do. I lived in a basement lab, and I just absolutely adored it, and I was going to go into the molecular realm, and it was just absolutely fascinating. And I was just super psyched, and so I graduated from Penn, and I started doing some molecular work in a lab outside of Philadelphia, which was amazing. And it was out in the woods, and the labs were out. We'd go out and take samples from the riverbed. I mean, it was about as cool as you could get for a science gig. And even there, I just couldn't handle it. I was staring at petri dishes all day. I was basically living in a basement lab, and I was like, this is not what I was looking for. I was fascinated by the science behind it all, but the actuality of doing at least that kind of science, just, it wasn't for me. And about, maybe I felt like I needed to see people, I needed to interact with people, and it wasn't doing it. And maybe about a year into that, I just said, this is it. I can't do it anymore. I'm not going to go the PhD route. I'm not going to apply. This is just not for me. It's not fulfilling some part of who I am, that is really, really aching to get out and to find what it's looking for. And so, I don't know, I did this really, really trite thing where I had saved up money from working, and I went to Goodwill and bought a rucksack, and I just bought a one-way ticket to Mexico. And for about a year, I just traveled around Central America, trying to quote unquote find myself. So in many ways it was a very trite thing, and I down in ended up down in Guatemala, and this was maybe 9 months in or so, and I met this person who for in future years I kind of considered my oracle in a way. And this whole trip I was looking and I was tasting and I was seeing so many new things and learning so many new things, and I was just trying to have an open mind and see where the universe would take me. And I remember having this conversation with this person in this very magical place in Guatemala called Lago Atitlan. And I said, I just have this, I'm so passionate about science. I love that so much, but there was something missing. The human element, the art was missing. And she said, "Oh gosh, Josh, you need to go to Bastyr and become a naturopath." And I had absolutely no idea what she was talking about at all. But I was so intrigued, and so I found the internet cafe in a neighboring town, and just kind of plopped myself down for the day and tried to do some online research, and found out about Bastyr and naturopathic medicine, and really over time started making international phone calls from these international phone kiosks that they have, and trying to figure out what is this thing, and is it really as amazing as it sounded, because it sounded to me like this was it. This was a marriage between science and the heart. This was a marriage between holistic healing, medicine from food, medicine from plants. It was almost like this modern medicine man type of thing. And I was like, this can't be for real. This can't be legit. This is just too perfect for me. And I couldn't believe it. So I booked a flight home, and within a couple months, I went and visited every single one of the colleges in the US. And I was like, I have to learn. I have to figure out what this is like. And I quickly realized that this is exactly what I needed to be doing. It was exactly what I was looking for. And I enrolled that next September.
You went to every single ND college in the US?
There's
Like,
not that many of them, but yes.
but no, seriously, you toured each one before you settled on Bastyr.
I did, yeah. And I don't know. I'm sure. So you're out in Seattle. I'm sure you've been around the state park out there, St.
Mm.
Edward.
Oh,
Have you? Trails?
absolutely. I
Okay,
live really I
yeah.
live out in Snohomish, just outside of Woodinville. We go to that Bastyr, right beside Bastyr, this gorgeous park. We go, my son loves it. I've gone to Bastyr and ate lunch with my ND friends, and it's a beautiful campus. It's very it feels like going to Hogwarts.
I know, it totally does, and I'll tell you, so I showed up there, and I flew in, and I can't remember where I was staying. I think I was staying in a hostel downtown, and so, as you know, it's kind of outside of the city, and it's kinda hard to take public transportation there, and this was before Uber, or at least before I knew about Uber, and so I ended up taking a couple buses, and it dropped me off at kind of the bottom of the hill right at a trailhead. It didn't actually even go all the way to campus, and so my introduction to the school was about a 20-minute hike through these gorgeous Pacific Northwest woods, that beautiful, moist, lush feeling where you just feel embraced by the woods. And I was like, oh my. And so I arrived at the doorstep already sold. It's just like, oh my gosh, I would. And then, of course, you see the medicinal gardens, and then you meet the research department. And I was just like, oh yeah, this is it.
That is so cool. Well, I'm a big fan of Bastyr. I love so many of the doctors that have come out of Bastyr through the years. So, I love your story. The other colleges are fantastic too. Um, but it's interesting that you really connected with Bastyr on that level. So what was it like going through naturopathic schools, especially because you are so heavy? You're such a science geek.
Yeah, so I actually got my butt kicked pretty hard. I was super cocky going in, and it's like, hey, I was a science geek. I went through tough programs. I can handle this. I don't know about, like, I think would you say the gooey gushy medicine. This is going to be no problem, right? And my goodness, that first year just totally kicked my butt. It was one of the most difficult things I've to this day that I've ever gone through, and just totally blew me away. And it was I was trying to explain it to my family back, and at that time, it was no one knew what I was doing. I didn't even know about it until 6 months before, and so I was trying to explain to my family what it was like what is this, they didn't say Hogwarts, but basically what is this Hogwarts type thing? And I was like, this is how I have to explain it. I spent the morning in dissection cadaver lab, doing an exam that was probably the most difficult I've ever taken. I think I passed by the skin of my teeth, and I walked upstairs from the lab was in the basement. I walked upstairs from the basement to the courtyard, just emotionally and physically exhausted and drained. And I walked out the door, and in this courtyard is a circle of my colleagues and their teachers holding hands and meditating in a circle and oming together. And I said, I cannot explain Bastille better than that.
Oh my gosh, I love it. I love it. When I went, and long ago, many lifetimes ago, I became a massage therapist in Canada, and
Mhm.
it's like a 2 or 3 year college program, depending on what province. So it's not like here in the States, it's like a little, half year or 3 month program, and you're a massage therapist. In Canada, you could work in hospitals,
Mm, mhm.
and it's more like physical therapy. You can work alongside physical therapists and doctors. But before I went to massage therapy college, I went to Kerpalu, and I took a 200-hour bodywork training program because I just wanted to get my feet wet and see if it was for
Sure.
me. And the entire time was all about the spiritual element of
Mhm.
massage. And then I
Mhm.
went and took massage therapy college, and it was all about the science. And there was zero spirituality and zero, human emotion.
Mhm.
And I think the two would have been amazing to combine them. And so what you're sharing sounds like this wonderful marriage of heart and science. And that's so cool. And that really does sum up what it feels like to go to a nature path. You feel totally taken care of. You feel like a doctor's working with you, but you also feel like someone's giving you a hug and holding your hand.
Right, that is the dream, and that's definitely what we aspire to. And I think your experience is not uncommon in many different fields. We just have this tendency to kind of compartmentalize the different parts of our brain in that way, and it's sad. I think we lose a synergistic element to our humanity when we do that. And so it is really really beautiful whenever, in whatever domain of life you're in, when you can kind of combine those together in a meaningful way.
Now, what led you to want to focus on gut health? Was there some kind of event, like working with someone in your clinic, or what led you to be so interested in wanting to help people heal their gut issues?
Yeah, so it's probably a combination of things. So as I was going through the program as a student, I was also involved in a lot of research at the time, and most of our research was focused on probiotics. So from a research perspective, I was beginning to learn about and just get really fascinated with probiotics and how they impacted the gut, et cetera. And then when I graduated, I started working in a primary care kind of family practice right outside of Seattle in a town called Bothell, not too far from Woodinville. I actually lived up in Woodinville when we were there. But anyway, so we were doing family practice, and I was just doing my normal naturopathic family practice thing. And what I would notice time and time again, it's always fun when patients do really really well, and they come in the next day and they just give you a big hug, and they're like, oh my gosh, it's been transformational, and you're like, yes, I've done my job right. And what I started noticing was that my patients that we were working on their gut health, they would just time and time again, they would just have these massive transformational changes. And I was completely blown away. From a naturopathic perspective, we were just pretty simply treating the situation. We weren't getting super fancy, we were just healing and focusing on the gut. And patients were just, their lives were turning completely around, and the responses were so extreme and amazing, and the interventions were so beautiful and delicate, that I was just like, wow, there is really something here. And I started beginning to shift, my interest particularly towards the gut and the power that naturopathic medicine plays there. And then, I think what happened was one led to another, and then I started focusing more of my research in that direction and seeing more patients, and it kind of snowballed in that way. And so now now I'm out here in Colorado Springs, and I pretty much have an exclusively, gut focused practice, and that's almost the entirety of my research as well. And so I guess they've kind of fed off each other, but I think it was kind of a combination of seeing how effective it was on as a scientist, but then also seeing the impacts it had on patients.
I have so many questions for you. I'm so excited. So, can people see you all around the world? Like, can people Skype? Do you do telemedicine? Can someone Skype with you?
So I do telemedicine, but at least the way we're kind of following the letter of the law here is first visit does need to be in person. So I do have people that fly in and drive in from other states for that first initial visit, and then they, as long as they're within the state, we can continue it. But I don't do international consults or anything like that, unfortunately.
Oh, bummer. I'm thinking of so many people who have gut issues. Well, at least they're here today. They can learn from you. And hopefully one day you'll come up with a book or something and you can come back on the show and we'll just keep learning from you as you keep growing as a doctor because gut health is so important and I love that you get results. Now, back when you were still at Bastyr and you were spending all that time doing research, on probiotics, can you share some of your findings that you found fascinating about probiotics? Maybe teach us some things that we don't know about probiotics.
Yeah, well, I think that probably what was most interesting to me. So we did a type of research that was highly statistical called meta-analysis, and we worked for the Cochrane collaboration. And basically what that means is we would go and find all the research studies that had been done on a particular question and then kind of statistically combine them together and try to get closer to the truth. So if every research study is a sampling of reality and an attempt at finding the truth, the thought was that if we could kind of leverage all these studies together, could we get even closer to what's really going on? And so that was the type of research that we did. And I think what really blew me away. So at the time when I was a student, some of the research that I was doing on probiotics was on a condition called, and it's a mouthful, but it's called pediatric antibiotic associated diarrhea. So it's kind of a long one, but basically, in a nutshell, what it is if a kiddo has a bacterial ear infection, let's say, and they give them amoxicillin or an antibiotic, the idea is they ingest the antibiotic, it goes to the GI system, it gets absorbed, it gets to the blood, and then eventually it gets to the ear and it does its job. In the meantime, it kind of plows through the gut flora. So there should be a really healthy, beautiful garden of gut bugs there that are doing everything from protecting you to training your immune system to you name it. And we're learning every day more things that it does. But anyway, it basically, it's like taking a bulldozer through your well-kept garden, right? And so it may do its job up in the ear, but now you've left this big open patch in your garden. And of course, then it goes and rains, and the first thing that happens is a bunch of weeds sprout, right? So you get, what we call a dysbiosis, or kind of a messed up, a bunch of weeds in your garden. And for kiddos, the way this presents often in about, maybe 20% of the case of the time when they're given antibiotics is they will develop diarrhea. And so it's actually quite common. Like 1 in 5 kids will get this. And so what we were studying was if we kind of behind the bulldozer were, kind of broadcasting wildflowers as it went, could we, repopulate in a way to protect the kids' guts and they wouldn't have diarrhea and they wouldn't have this disorder. And so basically that's how we viewed using probiotics to kind of reseed or repopulate the gut. And what we found was that not only was it effective, but it was like extremely effective. The effect size was about 50% relative risk reduction, which is a huge amount from a scientific medical perspective. So a lot of what we do is kind of we take this drug or that drug and we know it quote unquote works because it's statistically significant. But if you actually look at what the effect size is, what it's actually doing, is almost always minuscule. It's always a very small effect size. And that's just the state of medicine. There are very few things that have really robust effects. And we were staring at the humble probiotic and it was blowing these other interventions out of the water as far as its effect size. And I think what that really struck home with me, because we were with really rigorous science and really rigorous methodology, we were showing that this humble natural product was having a massive impact. And it was an anecdote, it was well conducted research, and I think for the first time scientifically saw how powerful natural medicine could be.
And did I hear this right? That 50% of kids that took a probiotic, it would prevent this diarrhea from happening?
Well, so it would reduce your risk of getting it by 50%, if that makes sense. So, if 1 in if 20% of kids would go on to get diarrhea if they were given antibiotics, now only 10% would. So you cut the risk in half.
Oh, that's worth it.
Right. So it's a very large effect size, and I think we were all just kind of shocked. And actually, Cochrane, to their credit, did a big promotion campaign, but when we published that research, trying to get doctors whenever they were going to prescribe. It was kind of like the two hand campaign, where in one hand grab your antibiotic, but in the other hand grab your probiotic, because
Mm-hmm.
that's how impactful. And this is the conventional scientific community. So I think what I saw is when you have really hard science, and we don't have that with everything, but when that's kind of the language that conventional medicine speaks. And so it's a really great way to kind of show the efficacy of what we do if we can get really good methodological studies, and say, hey, look, guys, like, we're not making this stuff up. Look at the science behind it. We should be incorporating this into everybody's practice. And I think a lot of doctors are beginning to shift their practices. We published a study not long after that using probiotics to prevent C. difficile, which is a really nasty infection in
Mm-hmm.
hospitals. And you're in Seattle, where it's good. The docs really took that to heart and have kind of changed their hospital prescribing practices. But we're still fighting to get other hospitals to make it normal to prescribe probiotics at the same time. But we're getting there slowly.
You say prescribe probiotics. Are there brands that you can hands down say are above the rest? It's kind of a I've taken probiotics on and off my whole life, and there's only a handful that I actually noticed a difference. But
Right.
if you already have sort of normal gut health, I mean, does everyone need probiotics, or is it kind of like, hey, just take it just in case? Or is this, if you have gut issues, you definitely want to take it, but only these brands work?
Yeah, so those are great, really practical questions. Excellent. So I'm going to give you the really annoying answer, and then I'm going to try to clarify. So the really annoying answer is it depends, right? And this is what I think it depends on. So personally, so in my clinical experience, and personally, and just philosophically, I don't feel like we as human beings need to be taking pills to stay well, right? Like, the goal should be really good sleep, really good hydration, really good fruits and vegetable intake with a really good diet, and then some form of spiritual or mindfulness practice in your life, right? So that is, if we can achieve optimal wellness through that, then we're doing really, really well. And that's the goal that I really have for my patients. Now, sometimes patients come in really, really sick, and we do need to use supplements or sometimes medications to get them on the right track, in which case we'll use probiotics. So, but personally, no, I don't think everyone needs to be on a probiotic. But what I do tell them is, I do think it makes sense, in my mind anyway, that everyone should try to eat something truly fermented every day. And that's kind of how we've populated our guts over time, is by eating fermented foods and tasting the environment around us. And so it just kind of makes sense to me, and it's so much fun to make on your own. And
Mm-hmm.
so that's kind of where I try to lead my patients. If you do need to use probiotics, in my mind, it very often will depend on the condition. So we know that certain strains are really good for this condition, and other strains are really good for that condition. Ironically, with our research on C. diff, as hard as we tried to find it, we did not see that any one particular strain was better than any other. They all worked really, really well, and that goes against common knowledge, common practice within the naturopathic community and within the natural medicine community. But every strain studied worked similarly. So it may be that in certain conditions the strain may not matter, but in others they really do. And I think that's what we're kind of learning over time. And I think with probiotics, we're gonna get to a point where it's like saying, do drugs work? Some do, some don't. Depends on the dose, depends on the type of drug, and depends on the condition. And I think it's probably a similar story with probiotics.
Interesting. Can someone repopulate their gut health just by eating a variety of cultured foods, or are some people have so much dysbiosis that taking the supplement is the best route, and then in the long term they incorporate cultured foods?
Yeah, so good question. Probably, I would say it would depend again too. If we're just talking about, oh, you're gonna get really annoyed with me. Probably, if we're talking about like general repopulation, then just using a single strain or even a handful of strains is probably not the best route to go. So, the classic kind of gross example. I mean, have you had anyone on the show talking about FMT yet?
I don't think so.
Oh boy. Okay, so fecal microbial transplant. That's a great
Oh,
topic.
that. Oh,
Yeah.
okay,
Oh
okay,
yeah.
okay.
It's
I
it's
had
the code
one.
words we
I have
use.
a great guest who she is in Arizona, and she was talking about how people want to buy her poop because the she's in the top like 2 percentile
She's a
of
super
she's
donor.
a soup she yeah, she's been eating so many cultured foods for so many years that people offer her thousands of dollars for her poop and she turns them down, and I'm like, why are you turning these people down? Like, you're flushing thousands of dollars down the toilet every day. What's your deal?
Right, right.
um but yeah,
It's like, yeah.
but for those who don't know, with this poop transplant, and I have to tell you, when I first heard about it, I thought that this was like another whack job, like the MDs had come up with some total, like, here's another procedure MDs get to charge you thousands of dollars for, and I thought it was a total scam. But then I started to hear about like fat mice that are given the poop of the thin mice, like put the poop of the thin mice in the fat mice's butt, and the fat mice get thin, and then take fat mice poop and put it in the thin mice, and the thin mice get fat. And I thought, this is crazy, this is
Totally
crazy.
crazy.
This sounds so gross and so crazy, but it's happening. Some people are getting fecal transplants. So yeah, for those
Yeah,
who don't know, and it's working, and the fact is it's working. Like, at the end of the day,
right.
I want everyone to be healthy, and at some point we get to the point where we're like, whatever it takes. So for those who've never heard of
Exactly.
this
That's what
crazy
it
procedure,
is.
please do tell.
Right, but don't Google it, right? No, or don't Google image it. So yeah, so I mean, I bring it up because it's a real. So first of all, it's super gross, and everyone's kind of turned off at first, and like that can't be a real thing. But it's one of those examples of, in a way, natural medicine that we have some really solid evidence and research behind it. So much so that, at least for recurrent C. diff, it is standard practice in most hospitals now to do FMTs for patients where all the drugs have failed, and the response rate is actually absolutely amazing. And so, what you think of and the reason I brought this up is you have such a complex gut. I mean, we're talking about a extremely complex ecosystem, and it's not just one ecosystem. It changes in the different parts of the gut, right? From the small intestine to the large intestine, different parts of the large intestine. It's a completely different environment with different organisms, different amounts of organisms. It's like going from a desert ecosystem to a Mediterranean ecosystem to a Pacific Northwest ecosystem. The plants are going to be different. And it's very similar. And so when we take these probiotic pills, we're really just imbibing a handful of species that are convenient to grow in manufacturing facilities and are shelf stable.
Ew.
Right, because it's just really hard to grow what does really well in the low parts of the gut where there is no oxygen, the anaerobic species. It's hard to do that in an environment like where we live, where there's oxygen everywhere, right? So basically, you're really limited in repopulating. So I brought this up because, in theory, it would make a lot more sense to repopulate with a whole garden, and that's what FMT really is. It's taking someone's fecal matter, which includes usually 50% of the weight is actually bacteria. It includes seeds or plant saplings of all these different organisms, and then you kind of try to repopulate those gardens. And so people, we aren't doing that after antibiotics, obviously, but the take home is that's probably the most realistic way of truly repopulating a really messed up ecosystem. But for targeted interventions where we just, let's say, like constipation or something like that, then yes, we know that a specific, specific strains at a specific dose are indeed the most effective.
So could someone be doing more harm than good if they go to the super supplements, or supplement barn or whatever, and buy whatever probiotics are on the shelf and just start taking them? Like, can you introduce the wrong stuff, like too much of quote unquote healthy probiotics could be unhealthy?
I think so. And probiotics are probably, one of the things in our research that we do is we look at what's called the adverse events. So like the side effects of, the probiotics or the natural product, just like we look at the side effects of drugs. And all these studies compared it to placebo, and believe it or not, there were less side effects in the probiotics group than in the placebo group. So it's safer than a sugar pill. But I think, which was pretty amazing. But there still are situations where it's actually quite dangerous. So we should probably mention those. So it's not a panacea. We're exceedingly cautious in patients that have pancreatitis, particularly chronic pancreatitis. We've had cases of people dying
Oh my
when given
God.
probiotics. We're not exactly sure why, but they've had to stop research studies early because they noticed a huge uptick in that. So we just totally stay away from using them in patients that have chronic pancreatitis or even acute pancreatitis. And then the other is any severe immunodeficiency. So, if you think about it, you're introducing bacteria or yeast to the body. And if the immune system can't handle that or doesn't know how to deal with it appropriately, you can get an infection. And we've had cases of that where in some research studies, in some case examples, people that were severely immunocompromised would get sepsis, which is infection of the blood
Mm.
from the probiotics that they were using. So those are the cases that were very dangerous to use probiotics. It seems to be very safe in other conditions, but what I would say in most cases, people aren't walking around severely immunocompromised, and I do see that they cause problems, and that's particularly in a condition called SIBO. I don't know if you guys covered SIBO in any of your
We have
podcasts?
not specifically covered SIBO. I think we've had people mention it, but not like a whole episode on it. So if you want to
Gotcha.
just explain what it is. When I learned about SIBO, I was like, "Are you kidding me?" I mean, it's like I've heard candida, in the colon is like everything's been about the candida in the colon, and all of a sudden now we've got to be worried about the small intestines, and it went against what I thought was kind of, they say take lots of probiotics for candida,
Mhm.
right? But now
Mhm.
they're saying for SIBO, so they're saying no probiotic, no, don't take the
Right.
probiotics, and even certain prebiotics. So it's
That's
kind of
right.
like backwards. So yeah, go ahead and for people who don't know what SIBO is, could you explain what it is and also what are the symptoms of it?
Yeah, no, absolutely. So I think what you've said is exactly right. So SIBO, and people pronounce it a zillion different ways, is short for small intestinal bacterial overgrowth. And basically, in a nutshell, in your large intestine, in your colon, you should have a whole bunch of good, healthy bugs. That's the garden we've been talking about. And in the small intestine, which is above the large intestine, so basically you eat food, goes in your mouth, goes down your esophagus, goes to your stomach, and then it goes into the small intestine. So that's what we're talking about. In There should be some bugs there, but not a lot. Nothing like what we see in the large intestine. And for a zillion reasons that we're not going to probably have time to go into today, although maybe later, is you'll have bugs basically migrating up from the large intestine into the small intestine. And when you eat prebiotics or particular types of food, like FODMAP foods, they eat it, they love it, they ferment it, they cause gas, and people will often experience that as bloating, diarrhea, constipation, and abdominal pain and cramping, which of course are all extremely common and is exactly what IBS is. And so we actually think a lot of IBS is probably caused by SIBO these days. And this is kind of new research and we're still figuring it out. But that's kind of the short of it. And so the idea is if the problem is too many of good bugs in the wrong place, and then we're going to go and give people more bugs that they're eating and it's going down their esophagus and through their stomach into their small intestine, are we just making things worse? And that's the rationale. And I would say clinically, I maybe 60, 70% of the time, I'll have patients come in. I think they end up having SIBO, and they've been kind of doing what you said. They went to the supplement shop and they bought probiotics. And they're like, Josh, it doesn't make any sense to me. I know probiotics are good for me and are good for guts, and I've got a gut problem. But every time I take a probiotic, I feel worse. And I'm like, well, that makes sense because I think what we're doing is actually just reinforcing that problem.
So, in some people, taking a probiotic and the probiotic ends up just planting its seed too early, planting its seed in the small intestine, which is not where you wanted it. Um, what is the environment that allows that to happen? And would that have happened if they just ate cultured foods?
All right.
Is it
Yeah.
is it the environment of the body that allowed that to happen, or was it the external, supplementation that caused that?
Okay, wow. So excellent, excellent, excellent question. So I think it's kind of both, and it kind of depends. So I think what it is so for example, lactobacillus is a very very common probiotic, and that's because it's shelf stable. We can make it in manufacturing plants, and it's in dairy fermentation, and industry knows it well, so it's easy to make a pill and sell a pill. Lactobacillus lives very happily in the small intestine. That's actually its like normal habitat. And so I think very often, so it's not that there's anything wrong with the environment or wrong with the probiotic, but that's kind of its home, right? And so it's passing down. Some of it's going to make it to the large intestine, but a lot of it's just going to thrive in the small intestine. So that's the external factors. What the reason people get SIBO is kind of multifaceted, but oftentimes it's because the normal kind of sweeping motion that the body makes to sweep those bugs back to the colons, back to the large intestine, sweep it back, keep the population kind of low, that breaks down. And so it could be that in someone that doesn't have SIBO and they take a probiotic, it's populating to a certain extent, but then the body's kind of keeping it lower down and it's not causing a problem. But for folks that have a problem with that mechanism, then we see those issues occur. So I think it's probably both. It's both the external probiotic that you're taking, but also what sets you up to have SIBO in the first place, and that's kind of allowing it to kind of hang out there and fester. And as far as eating fermented foods, I actually tell my SIBO patients to avoid fermented foods, just because I feel like that can lead to a problem. They're usually more diverse as far as what bugs are in there, but many of them do have lactobacilli strains and species as well, especially dairy fermented.
This mechanism, what sets someone up to have it? Is it because their hormones are out of balance? Is it because their diet's out of balance? Is it because um, they have more weight gain, or is it what's going on that cause that body? Do you see any commonalities among people that have kind of like the perfect storm that creates SIBO in their body? And once you've helped someone to regulate the proper amount of probiotics where they're supposed to be in the gut, so they no longer have the SIBO symptoms, are they able to fully heal where now that they're fine again, or do you find that they, like, for the rest of their life they need to really watch what they eat?
Yeah, so these again, great questions. So one of the most exciting things about being in this field is that it's, especially when we're talking about SIBO and IBS, it's a very much an emerging field. So, back in May, I just got back from the main gastroenterology research conference that was held there that year. It's called DDW, and they had, maybe the small handful of studies that have been done on SIBO were being presented there. So it's very, very new, and the GI docs were hearing about it for the first time. A lot of this research has been done in the past year or 2 years, so it's very new, cutting edge stuff. And I think a lot of times patients, in a very frustrated way, will try to talk to their doctors about it, and it just hasn't filtered down yet, right? Because it is that new. But so this is what we know from the latest research. So there are associations. The things that are associated with people getting this are things like having radiation. So maybe they had radiation for a previous cancer in their abdomen, and we think what's happening is the radiation is actually causing scar tissue that is hindering the movement of the colon, or pinching off the colon in a way that that sweeping motion cannot continue. Abdominal surgeries, people that have had appendicitis and surgery for it, or even C-sections, a lot of people have had pelvic and abdominal surgeries, and a huge percentage, as much as 80%, one research study showed, of people that have had these types of surgeries will develop some form of adhesion, which is like a scar tissue. And sometimes that scar tissue can pinch off or inhibit this normal motion of the colon, is what we think is going on. So it's not enough to cause like the colon to die, but it's enough to impede this sweeping motion. So we know surgeries, we know radiation. We now know that levothyroxine, which is a very common drug for thyroid disease, is associated with it. Now we don't know if that's the actual drug or being low thyroid that's causing it. So we're still trying to figure that out.
Mm.
We have conflicting research on drugs called PPIs, which are proton pump inhibitors, extremely common, extremely problematic, extremely overly used, and in my opinion, very often inappropriately used. And so some research suggests they're associated with SIBO. The most recent study I saw on this suggested that it's not. And so that's kind of still an open, debated one. Diabetes is certainly associated with it. So anything that can kind of mess with the nerves, the blood supply, or the physical motion of this sweeping will lead to it. And so to answer your question, that's what leads people up to it. And if you successfully treat it, if you're not treating the root cause of their SIBO, so the root cause of their symptoms, the root cause of their IBS might be SIBO, but if you don't treat the root cause of their SIBO, aka the adhesions in their gut, or their diabetes, or the medications that they're using, then it will very likely come back. And the latest research on SIBO is from the Target study, and we're seeing up to 60% recurrence in some folks. So, like I tell my patients, if you're the lucky third, it's one and done, and we treat it once and you're cured forever type of thing. And then those are really great days when they come in skipping and hugging. But for other folks, it may come back 6 months later or 2 years later because we haven't fixed the root cause of the problem.
Up ahead in our interview, Dr. Joshua shares some amazing information about how we can heal what's often mistaken as IBS, SIBO, small intestinal bacterial overgrowth, some amazing new tests that are happening, some great research, and how he helps his patients to heal their IBS, to heal these symptoms, to get the gut health back into order. It's so exciting to bring Joshua here today to teach you this wonderful information. I wanted to let you know that, years ago I healed my type 2 diabetes using food and supplements, natural medicine, learning from naturopathic physicians. I have since become a health coach, and I love helping people. I've helped a lot of people reverse their diabetes, reverse their hypoglycemia, hyperglycemia, and get their body to a place where they have healthy, stable, normal blood sugar. Even those with type 1 diabetes can improve their health to the point where they need less insulin. And this leads to longevity, leads to, well, looking better, looking healthier, and feeling healthier, more energy, better sleep, more mental clarity, stable mood. You actually save on your grocery bills because you end up needing to eat less because your body's in balance. And I'd love to help you if you're one of the many people. In fact, the statistics now are 1/3 of the US population, for example, has some form of blood sugar disorder. It doesn't mean there's something wrong with you. It just means that your nutrition's out of balance, your food's out of balance, stress is out of balance, and there's some habits I can teach you, some healthy habits. There's some food changes, there's some supplementation to nourish your body and refill your nutrient tanks. I would love to help you. If you have any of these issues with blood sugar, or maybe you are worried because the last time you got blood work, it showed that you were on your way to having blood sugar issues. Let's catch it while it's still new and get your body back into balance. Or maybe you've had relatives who've had diabetes and you don't want to create diabetes. I can show you the way to create your lifestyle in a way that's healing for you, that brings your blood sugar back into balance. Please visit bloodsugarcoach.com. That's my website, bloodsugarcoach.com. Put in your name and your information, and you can book a free 30-minute consultation with me where we'll talk and we'll see if how I can help you and work with you to support you in your success. I really want you to be successful in your life and in your health. That's why I do the Learn True Health podcast. And I'd love to be your health coach and to reverse your blood sugar issues so that you now have normal, healthy blood sugar. I'm just very, very passionate about it. So please go to bloodsugarcoach.com. Also, anyone in your life that you know that has blood sugar issues, please share that website with them. Let them know that if they're ready to bring holistic health into their life and take their life to the level where they're symptom free, where they're healthy and have regular blood sugar, they too can go to bloodsugarcoach.com. Thank you so much for listening. Thank you so much for being a listener and sharing my podcast. Please continue learning and implementing this wonderful information from all these amazing guests. I know you're just going to love what Dr. Joshua has to say next. So enjoy the rest of our interview. What kind of treatments? You mentioned treatments, especially for those 1/3. What kind of treatment? I know everyone's an individual,
Right.
but just to paint the picture, what does it look like to be treated by you, an ND, to heal the root cause of SIBO? And just give us some examples of different treatments so we can kind of just understand the picture. Because an MD, it sounds like it would be drugs or maybe a fecal matter transplant. Um, but there's not, there's not a lot of really getting to the root cause when you go see an MD. That's why I love NDs, naturopathic physicians. So yeah, if you could paint that picture to give us the idea of some of the treatment plans that you've created with patients. Again, understanding this is just examples and
Sure.
every patient's individual. What do they look like?
So yeah, so I think that's kind of fun and a good example of, like you said, a naturopathic approach where conventionally, if this is dealt with at all in a conventional world, it's often treated with a drug called rifaximin, just like you said. It's a drug treatment. It's actually, as far as drugs go, a decent one. From a naturopathic perspective, the way I view it is just like you said, we're all individuals, but also we're a holistic being, right? It's not just the bugs. What got the bugs there, and what can we use holistically to get you back to health? So it might look like using herbal tinctures, which are herbal extracts in alcohol or glycerin, or herbal supplements that are extracted and put in pills, using herbs to kill back the bugs, but then using different herbs and foods that promote that natural sweeping motion. We talk about changing the way people eat. So actually the timing of eating is very important to promote the sweeping motion. And so we're sitting down with people and we're working on not just what they eat, but how they eat and how they space their food and how much they eat and how slowly they eat. All these things are associated with what types of food do they eat. So we talk about FODMAP foods and foods that feed these bugs and foods that don't. We use, if we think there's adhesions as a cause, as a root cause there, then we're bringing in physical medicine. And can we work with PTs or visceral manipulation or other approaches that really move around the organs in the gut and actually break up these adhesions? So we really try to view it holistically and say, what are the causes here? How can we approach this from a multifaceted perspective and really give people the best chance? And I think if you do stuff like that, it's better than 30%. In my clinical experience, it's probably 50 or 60%. But the hard research says 30. That's just when you treat people with a drug. We don't really know yet, and we'll have to run that study, and hopefully soon, what happens when you're actually treating the root cause and you're bringing in a holistic approach to the treatment, which is what's really fun about being a naturopath.
I love it. And for those who don't know what FODMAP is, can you explain that? Should only people who have SIBO be avoiding the FODMAP foods, or I mean on that list of foods, or should anyone with a gastrointestinal problem or IBS consider that diet?
Yeah, so it's really FODMAP is really popular right now. So at the DDW conference, I would say 70% of all the talks, and we're talking about hundreds and hundreds of talks, were either about FODMAP or the gut microbiome. So this is the very cutting edge research development in gastroenterology right now, which makes it really exciting. But basically, what FODMAP foods are they're foods that are really high in, that's what it stands for, fermentable oligo, disaccharide, monosaccharide, and polyol, so FODMAPs. And so really these are specific foods, often foods that are very healthy for you otherwise. So people feel like what's very common is people say, hey, Josh, I've got gut problems and I've done what I'm supposed to do. I'm eating a whole bunch of vegetables and I'm eating a whole bunch of healthy foods and I'm eating a whole ton of garlic because I know that's good for me. And I'm also taking a whole bunch of probiotics because I know that's good for me. And if what they have is actually SIBO, all those things are going to make them way, way, way worse. Oh, and then they'll say, oh, and I eat really frequently because I know it's really important to eat small meals frequently. So all these things are great for most people to stay healthy, but are like horrible for people that have this problem because it just feeds those bugs for a bunch of reasons. And so, is it good for everything? So I think what you'll see now is GI docs are beginning to use it for everything. So whenever there's a problem they're not sure about, they say, okay, try this FODMAP diet, which isn't a bad idea. But I think from a mechanistic perspective of understanding how it might work, it's probably most effective for SIBO. And so we have a lot of research now using it for IBS, showing it's effective. And that's probably because most of IBS is actually probably SIBO. And so by giving them people a low FODMAP diet, they're actually able to avoid those foods and not promote the SIBO and improve their IBS symptoms. So that could be it as well. And then also there are foods that promote something called an osmotic effect, which is basically draws in a lot of water into the colon and causes GI symptoms. So to answer your question, it's being used more and more for many different GI complaints. I think it's certainly a reasonable thing for people to try. I would say it's a very hard diet to do and one that should really be done with a medical professional. I think unfortunately people are just kind of given a handout from their GI doctor saying, here, do this diet. And I've had patients that come back that have been on the FODMAP elimination phase for 2 years.
Oh my
And
gosh.
it's like they're supposed to do that for 2 weeks and then or a month max and then start reintroducing. They're not, and they've been basically eating nothing for 2 years. And it's like, oh, yikes. So I think it is best done with some form of medical professional, whether it's a nutritionist or a naturopathic doctor, et cetera. But yeah, that's the basics of it. And so that is a common diet being recommended now for IBS and SIBO.
Interesting. There's an app. I mean, this was years ago, but someone I know close to me had SIBO, and there was an app, and I think the app was like $10, and I was like, okay,
Hmm.
well, fine, it's worth it because like I'd never paid for an app, and I probably never will again. Um, but it made it so much easier because this handout that the doctor gave us was just that. Here's the handout. Don't
Yeah.
eat these foods, and I'm like, how am I going to cook like this? So,
Okay. Yep. You
um,
know the experience.
yeah, so the app, which I'm sure there's a lot more information out there because this is years ago, but or a few years ago, but there's an app, and you pay
Yeah.
like up $10, and then
There's
you
some
go to
great
the
ones.
grocery store and you're like, okay, pull up my app. Here's the foods you can eat. Here's the foods you can't eat. But that's really interesting about how you're only supposed to do it for a very short period of time, then start reintroducing. It's sort of like an elimination diet.
That's exactly right. That's exactly right. So the classic, and first of all, I'd say I think I know the app you're talking about because I use it all the time, and so no affiliation with the company, but it's called the Monash University Low FODMAP app.
That's it.
You type it in, you'll find it. It's $8 now.
Okay.
It's even better, and they're updating it every. They're the ones that pretty much have done all the initial research on FODMAP. It's a university in Australia, but and most of the apps out there are horrible, but that's actually a really good one. So I completely agree with that assessment. And so, I was on a tangent, and now I forgot where we were going. Uh,
Elimination diet.
Oh, right. Yes. So I would say that the standard naturopathic elimination diet uses basically has patients avoid common trigger foods and foods that may trigger the immune response, basically. And then you do that for a month. You see if patients get better, and then you reintroduce and basically test each food as you go through, which I think personally everyone should do at least once in their life. You learn so much about your body.
Mm-hmm.
But the FODMAP idea is basically the same in that you're avoiding all high FODMAP foods at first. You see if you get better, and then you reintroduce the foods and test them one at a time or by groupings. And that is the same idea. You eliminate, you see if you feel better. Okay, so obviously something you took out was causing a problem. Now we see which thing you took out causes a problem by reintroducing it and seeing if your symptoms come back or not.
So it's a very slow and holistic, gentle process where you're getting to the root cause in terms of if food was the problem, then you can get to what the problem is. Now, you also mentioned eliminating foods that are triggering your immune system. Do you recommend a certain test, like an IgG test?
Yeah, so this is another fascinating question, and a lot of my colleagues will disagree with me on this one. We're actually in the middle of a research study. It's called a Delphi study, where you combine a bunch of experts in the field. So we got a 15 different naturopathic experts on IBS together for this study. Just fascinating results. We'll be publishing it soon. I'd be happy to share it at that time. But what we're learning is that, yeah, a lot of naturopaths, and it's considered good practice according to these experts, use blood tests like IgG testing and things. And I've used that for years when patients just couldn't. I always prefer the elimination diet, but sometimes A, your symptoms just don't work well with that, or B, patients are underweight and you don't want them to be eliminating a bunch of food,
Mm.
or or there's some fear of orthorexia and you just don't want to go there,
Mhm. Mhm.
or it's just patients are like, Josh, that's impossible. I've got birthdays and kids' birthday parties, and there's just no way for 2 months I can have this
Right.
much control over my diet.
Right.
So
Or if there's
there.
like emotional eating, you don't
Mhm.
want to restrict an overeater like so severely because it makes them go crazy.
Yeah,
So
yeah, well,
yeah,
yeah, right? You're taking
right.
away a coping mechanism, right? Without replacing it with something else.
Mhm.
So yeah, no, I think that's wise, and there's really good reasons why people shouldn't necessarily do it. So what I would do in situations like that for years is do the IgG test. And so last week, so this is brand new. Colleagues of mine at Yale, this guy Ather Ali, he's actually a naturopath. I believe he was trained in one of the Canadian schools, but he's gone on and now, I think he has an MPH or PhD now. He's the director of one of the integrative centers at Yale. Just a brilliant researcher, and he just published a study on a different type of food sensitivity test called the ALCAT test, which for years I thought was ridiculous and almost very often would say there's no way this works, right? And let's use the IgG. That's way more scientific. Except that he published this study last week and it's extremely effective and actually really good evidence. So now I'm kind of changing my tune a little bit, and we'll probably start using a lot more of that. So to answer your question, yes, there are tests for food sensitivities. Ideally, you can do elimination rechallenge diets to find it, but there are blood tests available, and the often quoted fact of, oh, there's no science behind those is not necessarily true anymore. We're beginning to find and develop that science, and we've got a decent, rigorous, not huge, but beginnings of a strong evidence base behind some of these technologies. So I certainly incorporate that into my practice, and I think it's kind of a combination of using the best in recent science with just good general naturopathic approaches.
The ALCAT test, I just Googled it. ALCAT test. I'm interested. This is exciting.
Yeah.
It's called a cell, or there's like this one website, Cell Science Systems. There's another website, What's My Food Intolerance. So there's a bunch of websites that are talking about the ALCAT test. What is it? Like what is it? How is it different from the IgG test?
Right. So I'm certainly not an expert on it, and I haven't used it for a really long time. And so probably not the most informed answers. But basically, my understanding is with the outcat testing, and again, no affiliation with the company or anything, but you're basically looking at the way the white blood cells, which are the immune cells, respond when challenged with different food particles and things like that, and basically seeing how if they flip out or not. Right. The IgG test is similar in a way in that you're looking for see if the body has made an immune response to particular types of foods. And the classic, I ate a peanut, now I'm in the hospital, that's an IgE response. So those are usually the more extreme allergic responses. Ig are the more subtle immune responses. Not everyone agrees that they're true allergies, so sometimes we just say the word sensitivities instead of allergies, but it's a similar process, just a different type of antibody. So they're kind of technical. I think the take home is both of them test how the immune system responds to particular food challenges, to give us a sense of, oh, well, maybe your immune system is thinking that the corn that you just ate is a massive invader into your system,
Mhm.
and it should be on high alert and bring on the nuclear option. And there's really nothing necessarily evil about this bit of corn except it's triggering the immune response, and the immune system thinks it's a parasite, or whatever it is. And so we think it's kind of an oversensitive immune response in a way.
I'm glad I have you here because you are so grounded in the science. I hear a lot of theories. And one theory is that this concept that our body could become allergic to seemingly healthy foods like a strawberry, a banana, a piece of corn, a carrot, um, is derived from leaky gut syndrome,
Hmm.
where for example we eat gluten and we're not like, as a species we're not supposed to eat gluten, or what is now wheat is not the wheat of 100
Right.
years ago, and this complex protein ends up tearing the microvilli, and some partially digested food particles end up in the bloodstream as a result, and then the immune system attacks it, and then the immune system recognizes it as a foreign object from then on.
That's
is
right.
is this theory grounded in science?
Yes, I would say that we have. Okay. Yes, in that we do have scientific rationales on how this might happen, but we don't necessarily have the most robust evidence base for all of the pieces of this, right? I guess to answer that question. So again, anything in medicine, whether it's conventional or natural, we're going to be anywhere from zero research evidence to petri dish evidence, all the way up to like 40 different randomized controlled trials, right? So it's all somewhere in that continuum. So I would say, yeah, I do believe that that happens. I do think we have a plausible scientific explanation on why that might be, like you said, via leaky gut. I do think it's rational to say that a lot of these foods are very different than what the body has been used to seeing for a very, very long time. We do know that with inflammation, that the membranes will become quote unquote more leaky. We do absolutely see that. And this idea that we have, immune cells constantly on the other end of the digestive system tasting the environment and making sure that there's no foreign invader. And then, yeah, if they're more likely to see an undigested particle or partially digested particle, they may quote unquote flip out, create more inflammation, and we get this crazy cycle. I don't think that that's super far fetched. I think it's reasonable understanding of how things work, and I do use that model with my patients.
Got it. So, my next question would be then: do you recommend everyone go gluten free or grain free, especially for gut health?
Yeah, so actually, again, many people might disagree with me. I not necessarily. I tend to just philosophically feel that there's no such thing necessarily as an evil food or as this is always bad. You can probably already tell from my many it depends is that I just don't swing that way. And so I think that some people seem to be able to handle gluten. And other people seem to be very sensitive to it and or can get sensitized to it. It's I the reasons of it, oh, we haven't evolved with it, et cetera, et cetera, that certainly makes sense to me, but I also think clinically many people seem to do quite well with it. Is it possible that if we look in their intestines there'll be some minor inflammation? Possibly, but possibly not. And I think we have to also remember that we can't over-diagnose everybody, and we can't spend 80% of our time freaking out about our what we eat and healthy and what's healthy, what's not healthy. And it was healthy last week, but now it's horrible. Now it prevents Alzheimer's. Then next week it's going to cause Alzheimer's. I think people really, and I know I do, really freak out about that kind of stuff. And how could you possibly relax and enjoy life and enjoy eating? One of the most heartbreaking patient situations that I've ever had was I had a patient who, went through breast cancer and was, just a really horrific experience. And she was on the other end of it, and she was doing really, really well. And all of her oncology markers, her cancer markers were really, really good. And her cancer doctors were really happy with her progress. And she was through the woods, right? But she had gone to a practitioner who had done like all this testing and came up with all these things wrong with her and all these things that she shouldn't be eating that she was. And what it led to was she couldn't eat anything. And the most life giving thing to her was to sit at the end of the day and cook dinner with her husband. That was her favorite thing that she liked to do, was
Mm.
to cook together with her husband and and eat a wholesome meal. And she was so afraid to do that that she hadn't done that in years now. And I spent I spent a really long time going through all of her records trying to figure out, is there something really wrong with her that I'm missing? Why would people be making these recommendations? And for her, the best, at least in my opinion, the best medicine was to actually be able to live a normal life and relax with her husband and celebrate her victory over cancer and sit down and cook a meal and not be afraid to eat and be terrified that everything you're going to consume is going to cause another cancer. Your cancer is going to come back. And certainly there are cases where there's strong immune responses and you do need to be worried about that. Or if she was, there would be lab values that I would not make this recommendation. But for her, she was doing good. And she was just being kind of over pathologized, and it was totally impacting her health and her sleep, which of course we know impacts her immune system and its ability to, of course, to surveil and protect against cancer. So it was just
Mm.
this horrible situation that really struck home for me the power of sometimes less is more, and prescribing stopping doing things and prescribing to take less pills and just focus on the things that really nourish you and bring life to you. And with her, it was being able to sit down and cook pasta once a week or something. It wasn't good. The world wasn't going to
Yes.
collapse.
What I love about this is another great example of how healing naturopaths are is that you not only look at her labs, which MDs will do as well, but you looked at her life and you looked at and you figured out, you sat down and talked to her and figured out her values and her emotions. And you looked at her life as a whole and you realized that there's so much healing in connecting with a spouse, connecting with a loved one, and sitting down at a table filled with loved ones enjoying a meal. That is so healing to the nervous system that if you happen to be eating that piece of gluten cake, the ill effects of that one piece of cake are probably outweighed by the amount of de-stress. In fact, I'm forgetting the name of the town in Italy. You probably know this because there was a giant study done in this small town in Italy where people were very poor and they all worked in the factory and they had the longest lifespan. And now, unfortunately, that town no longer has this wonderful lifespan, and they had the lowest rate of heart disease at the time because and they all ate fried they all ate lasagna, they drank wine like crazy, they smoked, and they ate fried meatballs, and they had the lowest rate of heart disease. And what they figured out was the commonality was that they all were so tight knit.
Mm.
Each household had at least three generations living under one roof. I mean, they were very
Oh,
poor,
wow.
so they
Yeah.
had the grandma taking care of the kids. Every neighbor knew each other. When you walked home from work from the factory, you stopped by at least three friends' houses that you have known since you were born, and you sat down and you had a coffee or a wine. The entire town knew each other. And so if one person fell into depression or fell into hard times or needed childcare, there was the entire town to help them. And
Yeah.
that one piece, it didn't matter. They all smoked, they all drank, they all ate fried food every day. They lived the longest life on average than anyone else in Italy, and they had the lowest amount of heart disease because they had low stress levels, because they had a support system. And so you're right that
I love that.
spending that time cooking with her husband was incredibly therapeutic. And that kind of observation is something you're going to get from a holistic healthcare practitioner that's going to take into account that, yes, your emotional health is as important as your physical health. So I love that you observed that you became the detective in her life and you helped her get her back on track. I'm really interested in the LCAT test because the what I've heard from some practitioners is with the IgG test, is that if you've been avoiding that, let's say a food you normally react to, if you've been avoiding it for a long time, you might not be displaying an active um, irritability to that food in your blood. Is that correct? So if some, like, let's say
Right.
I don't eat bananas, but I'm allergic to bananas, would bananas show up on my IgG test?
Right. So that's exactly right. And so even, I mean, this is common even with the tests for celiac disease, right? If you, because you're testing similar markers and similar antibodies in the body, when you are completely avoided a particular food for a very, very long time, you're going to have a muted immune response, and so you may miss it. And so, absolutely, that's true. Which is why if someone who's been gluten free for 10 years, and then you do a test like this to see if they are sensitive to gluten, you can very often get a what's called a false negative, meaning the test comes back negative, but if they were exposed to gluten again for a while, these problems would come back. So I think that's definitely true. And I think as well, you're absolutely right about the focus on community. I think we're community dwelling individuals. I mean, that's what it means to be human. And there's all these elements of humanity that afraid get glossed over when we get too sciencey about things.
Mm.
Whether it's having that spiritual moment, having that moment with your husband, being in community like you described in that Italian town. I just love that. And these are all really important parts to health that have a really massive impact. And I'm afraid they often get overlooked. And one thing we talk about when we talk about evidence-based medicine is there's really three parts to that. There's the physicians or the clinician's experience, there's the best available research evidence, and that's what gets all the press, right? That's what we've been talking about mostly. But the third equally important part is the patient's values, the patient's experience, what they want to do. And even though the founders of evidence-based medicine clearly articulated this, when you actually look at the practice of medicine, that extremely important part always gets dropped out. And whether it's because you just don't have enough time with a patient in the standard setup or whatever it is, I mean, that is such an important part of being well and being healthy. And we so rarely look at that.
But NDs do. Naturopaths do.
Yes, I think if we're doing, and I think good doctors, when they're doing of any stripe, when they're doing their job, they're understanding or they're trying to understand the patient's values and incorporating that. And that's kind of the art of medicine, taking the patient's values, taking your own clinical experience as the doctor, and then also weaving in the best available evidence. And when you put that treatment plan together, and that any good doctor should be striving for that. And I hope that my colleagues and myself do that more often. I'd like to believe that we do, but I think any good healer worth their salt should be doing that.
This has been so incredible. We've covered so much ground and yet just scratched the surface. I would love to have you back on the show multiple times to talk about the different gut conditions that people are facing and kind of go into the holistic approach. I think everyone knows that if you go to an MD, you're going to get some drug or another, probably. In fact, I'm Canadian, and in the medical system there, although is for the most part allopathic, you get prescribed less drugs. So as a Canadian, I maybe one out of every four times I'd go to the doctor, they'd pull out their prescription pad. Like, and
Right.
here, every time I've been to an MD, and for about 10 years I was going to MDs in the States. Even before I moved here, I'd come visit a lot and stay here for several months at a time. Um, and every time I saw an MD, they'd pull out their prescription pad. And actually, many times I had to tell them I wasn't going to take a drug. Like,
Yeah.
I'd go to one for like, I kind of feel like I'd love to get an ultrasound um, my ovaries. I kind of feel this pain. I just want to make sure everything's okay down there. And he immediately pulled out a prescription pad. I'm like, dude, like I'm standing, like, because in Canada they don't give you a pain medicine unless if you can't stand, that's when they consider putting you on a pain medicine, like, or a sore throat. When I had chronic adrenal fatigue, I lived in Las Vegas. I had really bad chronic adrenal fatigue, and as you know, with chronic adrenal fatigue, immune, that the same things that cause chronic adrenal fatigue also cause immune suppression. And so
Hmm.
I every month had a throat infection. And so I was on a lot of antibiotics at the time. And every month I'd go there with a really sore throat, like very sore. And she'd always give me some kind of thing I'd drink that was like a pain medicine I drink. And I had never heard of that. Like, cause in Canada that doesn't exist. Like, you have a sore throat in Canada, they're like, suck it up. Go suck on a lemon. I have never heard of a pain. Like, are we all like what? I mean, are Canadians tougher or does like what
We're
is it?
so over
It
medicated over
is
here.
I could
Yeah.
not believe it. So they're really like, and I think if you've born into the system, so Americans born in America are used, they just think this is how it is. But I gotta tell you,
Yeah.
other countries, doctors do not pull out their prescription pad at every meeting. And I was floored at the amount of times I had to turn down MDs. I'm like, listen, I'm coming to you because I want to get to the I want to kind of get to the root cause here. I'm
Right.
not looking for a hand. I'm not looking for a drug. I'm not looking to suppress this symptom. Like my body is telling me the symptom for a reason. Like there's something
Mhm.
wrong.
Right.
And so thank God I came back to naturopathic medicine because you guys are looking for the root cause. You're looking to heal the body, not just mask a symptom. You're not in the pockets of big pharma, thank God. And so I so appreciate what you do. Now, you take it to the next level. You not only help people to reverse things like IBS and SIBO, you also work with holistic healthcare practitioners so they can be even more science based and cutting edge. I'd like to talk about that for a few minutes.
Sure.
There's a lot of listeners that we have that are holistic healthcare practitioners, and then those listeners who are not, they go to holistic healthcare practitioners, and so they could also share this episode with their holistic healthcare practitioner because we want our holistic healthcare practitioners to be even better, and the more results that we get, that's actually something I heard in the last few years from MDs is that they are losing patients because patients are, for example, they watch Dr. Oz, they go, wait a second, you can reverse this and you can reverse diabetes and no longer need to be on, like, my doctor's has had me on high blood pressure pills my whole life. You mean I
Mhm.
can reverse high blood pressure? Like, and they are leaving the MDs to go find more holistic methods. And so now MDs are kind of going, wait a second, I need to catch up. I need to learn how to actually get results that help heal people. And so slowly we're winning.
Right.
And so you help holistic healthcare practitioners win. Tell us a bit about how you do that. And your that website is Dr. Journal Club, so drjournalclub.com. Yeah, tell us about this and why a holistic healthcare practitioner would love to learn more from you.
Yeah, no, absolutely. So that's something I'm very, very passionate about. I think there's a huge amount of medical research out there right now, and we're doing more and more studies all the time, both on conventional and natural medicine. And it's very difficult for any type of doctor to stay up to date with the latest stuff. Like a lot of what we've been talking about this past hour has been on research that's just come out over the past couple years. And unless you're really tuned in, you may not have even heard about it as a doc. And so I think very often patients are hearing, because they're seeking out the cause of their problems and they're finding it and they're bringing it to their doctor and the doctor just hasn't learned about it yet, or the practitioner hasn't learned about it yet. So it became very apparent to me that we needed a way for healthcare providers to stay up to date on the best available research. That was number one. Number two was a lot of research out there done by really good scientists are total garbage, are really, really poorly done. There's really significant inherent bias within them. And that's both within natural medicine research and conventional medicine research. And so there's been a movement over the years, this evidence based medicine, to help providers ferret out the bias, find the studies that they can trust, and stay up to date and just provide good evidence-based medicine to their patients. And so I'm very involved in that, and a lot of my research has been on that. But what I quickly realized is that I think naturopathic doctors, integrative medicine providers, we often practice in a realm where there's very limited research evidence just because there isn't the money for it very commonly, very often, right? You can't patent a diet, you can't patent a particular natural product, and so there isn't a lot of financial incentive to run these studies. And so I think for many, many reasons, that being one of them, the integrative medicine world has fewer research studies, so we may only have a single study on a question. So it's, I think, more important for us to know how to find the bias, rip apart a study, say I can trust it, say I can't trust it, see what's wrong with it, than other docs who can rely on large research trials already been done and already pre-appraised and digested. There wasn't really this availability for natural medicine and integrative medicine. And I said, I think that integrative doctors need to be better at evidence-based medicine than their conventional peers for this very reason. We need to be rock stars in evidence-based medicine. And so that's why I created this site. It basically keeps docs up to date with research, but also goes deeper and teaches them how to evaluate the research themselves. And that's what I'm most passionate about. And I taught that at Bastyr for years before I moved. I teach it now for AIHM, which are MDs and DOs and NPs that are doing a fellowship in integrative medicine. Because just like you said, they said, hey, we're not seeing the benefits. We want to learn this natural stuff too. And they do a 2-year fellowship in this stuff. And I teach them how to read research and rip it apart. And it's so important for any provider, but I think specifically, and maybe even more so for a natural integrative medicine provider, to be an evidence-based medicine rock star. And so that's what the purpose of the website is. And now we've branched out into doing continuing education classes and in-person seminars and things. But the real heart of it is there. Let's be the best doctors that we can be.
I love it. I love what you're doing. So drjournalclub.com, drjournalclub.com. I'm so passionate about the science because in the science, we marry the science and the results with the holistic medicine, with the approach that looking at the body as a whole, their life as a whole, taking into account their social network, their social support, their tribe, their spirituality. That all we know plays a role. But otherwise we're throwing darts in. We're throwing, darts blindfolded. Um, I hate it when people say like, "Oh, I took supplements, they don't work," or "Oh, I went to an acupuncturist, it doesn't work," or "Oh, that study said, that thing doesn't work," and then they go and they go take 8 Tylenol a day, or it's like, well, that works. I get results with that. Well, they're killing their liver, and I want people to see that there's really solid evidence for the holistic way. We have been practicing natural medicine for thousands of years. That's how we, w- some people believe we've been here for over 2 million years. However, we have been here, however long we've been here, however, if we evolved, however we came to be, we know we've been here for thousands of years. And before allopathic medicine, which took place about 100 years ago, we survived using natural medicine, and we did it because, you ate that herb and you got better. And so now we know that we eat that herb when you have those symptoms. We had to trial and error it for thousands of years. And but now we've, so many people have turned to the I get sick, I take a pill, or get an injection. And the way our society is set up, especially with the food, it's just crazy. There's food like substances that aren't fit for human consumption, and we're raising an entire generation of people to believe that that is actually food.
Mm.
um it's like, giving rats pellets and expecting, them to believe that, this is food, right? um we're becoming guinea pigs in this giant experiment called make big pharma and make big agriculture, big food, as much money as possible. And this is really scary. So that's why I'm so excited about what you do, because you come back to, let's get grounded in the science. Let's figure out, like get rid of the dogma, figure out what actually works.
I
Um
like that. That's
yeah,
nice.
because there might be, for diets are weird, because the food map diet would work really well for people specifically with this, right? But you
Mhm.
can't take that diet and give it to everyone, especially not for 2 years like you said. So you can't just put a blanket statement and say garlic's always good for you, right?
Mhm. Mhm.
And with all the science, we can figure out when something's good for you, when it's not good for you, how much to take, what's the quality, what's the, so there's all these things. But if people just go to the grocery store and buy a bunch of garlic pills, that they may or may not get results. They may not get the results they're looking for. But when the science is there, then we can absolutely follow the science, but always marry it with the holistic medicine. So
Mm.
I love what you do. And I think it takes putting your ego aside, really putting your ego aside, because the dogma, we like to really buy into it, and sometimes is part of our ego.
Hmm.
And so we have to put the ego aside, like you did when you went, hey, I really didn't believe in the LCAT test, but you know what? The science proved me wrong. I
Right.
love that you can put your ego aside, and you can be really sure about something and then not really sure about something when you see the science. So we have to bring the beginner's mind.
That's beautiful. I just think that that is so well said. We are always learning, and doctors especially, we should be learning with our patients. And there's always new things to learn. There's always new ways to evaluate. And like you said, there may be things that we're doing for thousands of years that work, but what if we can learn how to make them work even better?
Right.
What if we learn that of these five things that have been in this concoction for thousands of years, if only four of them are the most effective, or maybe just the one, or maybe if we get rid of this piece, it's even better. So I just think that, and I loved how you said, and then marry the holistic elements into it too. That is, in my mind, really good medicine, is when you can, like you said, bring a beginner's mind to it. And I would say the same with patients too, right? It's all, well, just in life in general, be curious, bring a beginner's mind, bring a child's mind. Don't be afraid to question the dogma. I love that, because it's always changing and we're always getting better. And at the end of the day, all we're trying to do is treat our patients as best we can. And if we learn something new and different, okay, well, then let's try something else, and let's get to a point where we can help them get to their own optimal wellness, which is going to look different for everybody.
Excellent. Wonderful. It has been such a pleasure having you on the show. The links to everything that Dr. Joshua does is going to be in the show notes of today's podcast, so you can definitely check that out. Please, if you have a digestive disorder and you've been really struggling with it, I urge you to go contact him. See if you can, go have take a nice vacation to Colorado and see him in person. It is so worth it. I know people who've been suffering for years, and you don't have to be anymore. Joshua, do you have any testimonials on your website, or would you like to share any stories of success that you've had with people who were suffering for years with digestive disorders?
Yeah, absolutely. So there certainly are testimonials on the website for sure, and I think there are many. Probably my favorite is some of the stories that we've told over this past hour. But I think what is really amazing to people is that when you focus on the root cause of what's going on, and then you're not using this kind of shotgun approach as, oh, I heard this is good, oh, I heard that is good, and you're just not getting the results. If we actually think about what is the root cause of what's going on and do a targeted approach, that's when I see patients, that's when they come in the next time and give me the big hugs, right? That's when I know that we're doing good medicine, is when they say, man, I was trying all these things, everything that should have worked, but we needed to be detectives about it. And once we figured out what was the cause for me, then this targeted approach works, and now I can live my life again. Now I can thrive again. And that's always what we're going for. And with some patients it's going to be more difficult than with others. We don't always get there, but we try our best, and we keep on being detectives, and we keep on working at it, and we keep on trying to figure out what are we missing until we get patients where they want to be.
Awesome. And you always bring in the science and the latest science. I just love that. It's so reassuring to know that you constantly stay on top of the science. I have an amazing chiropractor. He's been a chiropractor for over 30 years, and he does these things like you never even fathom, like this stuff that's like just crazy, and it works so well that I hardly ever have to see him. That's actually the one thing I don't like about his amazing adjustments, is that he gets to the root cause so that I like never have to see him, and I love seeing him. And often when he's doing this really weird thing to me, he goes, "I saw this on YouTube and I thought that was a joke." And it wasn't. He is on YouTube all the time learning from other doctors, and then like seeing the science, and all these other chiropractors go and share their stuff on YouTube, and he shares his stuff. And it's so funny that like you plug yourself in, but he says, "Yeah, I just learned this on YouTube." And it's because he has that beginner's mind, but he knows what works because over 30 years, been a great chiropractor, but he's always willing to constantly learn the new techniques and the things that are
Right.
being discovered, and that reassures me. So I reassures me to know that you're so on top of the science, because I'd hate to go to a doctor that's really using 10 or 20-year-old information, especially in this the age of information, age of technology. I'd love to have you on the show again. We definitely have to talk more about different healing different gut issues. I'm really excited for the work you're doing. Thank you so much for coming on the show and sharing everything today to help people, especially with IBS and with SIBO.
Well, thank you so much. I had a blast. It was a pleasure being on, and yeah, I look forward to chatting more in the future.
Enjoy what you heard today on your episode of the Learn to Health podcast. Did something move you, inspire you? Did you get great information that's going to change your life? Awesome. That's exactly what I'm here to do, is to help you gain your health back. Please turn around and share this. If this is something that's helped you in any way, share this with those you love. Love the Learn True Health podcast and want to support us? Awesome. You can go to takeyoursupplements.com and you can support us that way. You'll get access to amazing supplements that are just really great quality for a great price. And there'll be someone on the other end of the line to help you pick out your supplements that are right for you. That's takeyoursupplements.com, or join our membership, learntruehealth.com/join. That's another great way to support our podcast, support our movement, and you'll be supporting yourself. Gain more information, wonderful videos, wonderful trainings, and you'll also be able to share those with those you love as well. So go to learntruehealth.com/join. Want something fun for free? Go to learntruehealth.com, and right there on the front page, you'll see where you can get our free cookbook. I spent a lot of time making it, and it was so much fun. It's really delicious, healthy recipes. And you can also get our 7-day doctor course. Right there, it's 7 days of naturopathic videos sent right to your inbox, and you can learn from top naturopaths on how to gain health naturally. So that's takeyoursupplements.com for wonderful supplements. learntruehealth.com/join to join our awesome membership, which is only open for a limited time. You can get our free healthy cookbook, and you can also get for free 7 days of wonderful naturopathic videos sent to you. Just go to learntruehealth.com and you'll see it right there on the front page. Thank you so much for being a listener, and thank you for sharing and helping others. Let's spread this information and turn this ripple into a tidal wave.